Good afternoon and welcome. We'd like to thank all of you for joining us this afternoon for a webinar, What Every Woman Needs to Know About Hepatitis B and C. We're very excited to have you join us with this call this afternoon and webinar, and we'd like to make sure that you can hear videos that we have embedded in our presentation today. So we would ask you to turn up the volume on your phones or on your computers at this time so that when we reach those points in the presentation, you will be properly clued in and can hear and appreciate the video. Without further ado, I'm going to turn the mic over to my colleague, Dr. Lydia Martinez from the Office of Women's Health, and she's going to introduce our first speaker.
Hi, and welcome to everyone to this important webinar on hepatitis and women. It is my honor to introduce you to Dr. Nancy Lee. Dr. Lee is the Deputy Assistant Secretary for Health, Women's Health, and the Director of the Office on Women's Health in the Office of the Secretary at the U.S. Department of Health and Human Services. Until this appointment, she worked for 7 years as a private consultant in the areas of public health, epidemiology, and cancer control. Prior to that time, Dr. Lee worked with the Centers for Disease Control and Prevention for more than 22 years. For 10 of those years, she was at the Division Director or Associate Director level. She has extensive experience in women's health, cancer prevention and control, data analysis, epidemiology, and surveillance systems. Dr. Lee received a BA from the University of Texas and an MD from Baylor College of Medicine. Please join me in welcoming Dr. Nancy Lee.
Thank you so much, Lydia, and welcome. Good afternoon. I want to welcome you all today to this webinar, What Every Woman Needs to Know About Hepatitis B and C. As people have said, I am Nancy Lee with the Director of the Office on Women's Health. We are proud to co-host this webinar along with the Office of HIV/AIDS and Infectious Disease Policy and to be part of the team working to implement the Viral Hepatitis Action Plan across the government. This webinar is an important part of our work to raise awareness about viral hepatitis and the many ways we can prevent new infections in women and their children and help those affected and even cure people with hepatitis C. Treatments also exist for hepatitis B, but most people who are chronically infected are unaware of their infection. Hepatitis B and C are the most common blood-borne infections, but we have tools to address them: a safe and effective vaccine for hepatitis B and accurate blood tests for hepatitis B and C, as well as treatments. But we need you to help spread the word about these infections. So I'm going to do a call to action. There is a lot of new activity in the field of viral hepatitis. What we have accomplished thus far is a great start. But I'm here today to urge all of you to learn about what advances are on the horizon and to discuss what opportunities there may be to make even greater impacts in this field. I ask all of you to identify opportunities to collaborate and partner to share the information you learned today with coworkers and your networks to provide viral hepatitis prevention, education, testing, and care. We can help the millions of people affected by hepatitis B and C. Only by working together can we address viral hepatitis, and I look forward, I look forward to working with you all. Thanks so much, and the webinar will continue now.
Okay. I'm going to ask my colleague, Dr. Martinez, to take us through the next session of this webinar.
Thank you, Chris. At this webinar today, you will be hearing from Christopher Bates, who is the Senior Advisor to the Director, and Ms. Karina Dan, the Viral Hepatitis Policy Advisor at the Office of HIV/AIDS and Infectious Disease Policy. and later on from our distinguished presenter, Ms. Andy Thomas, President of Health Trust. Today, we will be addressing the significance of viral hepatitis, its importance as a health issue for women and their families. We all know that many women are the decision makers on health matters for their families. So, it is important for them and the people who serve them to be aware and knowledgeable about viral hepatitis and its impact on their health and the health of their families. Our hope is that women become messengers of health and help spread the word among their families, friends, and communities. So, with that in mind, today's webinar objectives are to increase the awareness and knowledge of viral hepatitis and its impact on women among OWA grantees, partners, and all participants on today's presentation. Our goal is that today's webinar participants will share this information within the communities they work with, their partners, professional networks, families, and friends. So, today we will share with you all an overview on hepatitis B and C, online resources that are available to all, and we will also have a personal story that will make this topic real. Finally, we will conclude with a question and answer segment. Chris?
Hi, all of you should direct your attention to the screen at this time. What we want to point out to you is something that we are learning that a lot of people don't know, and that is where the liver is located in the body. Don't know that the liver is the largest organ that we have in our body, and not only that, I'm going to turn to my next slide. The liver also has 500 vital functions. Here are just a few of those functions. Immunity against infection. It regulates blood clotting. 3,4 protein and cholesterol. Clears blood of drugs, chemicals, and alcohol. Excretes waste via bile and converts excess glucose to starch for storage. Excretes bile for fat digestion. The liver is very important, and it does many, many, many more functions that support our health. What is hepatitis? A lot of people don't know that hepatitis means inflammation of the liver. Hepatitis is most often caused by a virus. At time of infection, a person is considered acutely infected with hepatitis. If a person is infected for several months or years, the infection is classed as chronic. Most common types in the United States of hepatitis are A, B, and C. However, today our focus will be heavily focused on B and C. And last but not least, heavy alcohol use, toxins, medications, and certain medical conditions can cause hepatitis. Here on this slide, we have the stages of liver disease. In the left corner, lower, you see a normal liver. Isn't that pretty? It almost reminds me of the liver that people eat from the cow, pig, or calf. However, on the left side, we see various stages of liver disease being manifested, moving from chronic hepatitis to sclerosis and to hepatoid cellular carcinoma, which is just an advanced form of sclerosis. And liver cancer is what it's commonly referred to as. Viral hepatitis in the United States is estimated at 4.5 million Americans are living with this chronic condition. About 15,000 people die from the disease each year. Asian Americans, African Americans, and baby boomers suffer from this condition disproportionately. Viral hepatitis is the #1 blood-borne infection in the U.S. and the leading cause of liver cancer. resulting in chronic hepatitis is often called a silent disease because many people don't know they're infected until there is severe liver damage. Most chronically infected people are unaware of their infection, roughly 65 to 75%. And lastly, blood tests can detect the virus, but few get tested. And this is one of the points and important aspects of today's presentation. What is hepatitis A? At this point, I'd like to introduce to you my colleague, Marina Dan, who will take us through hepatitis A, B, and C.
Great. Thank you so much, Christopher and Lydia, and of course, Nancy Lee as well. And I'd like to echo the thanks for spending part of your afternoon with us today to talk about viral hepatitis. And I think Christopher laid out a really nice case for why we need to raise awareness about viral hepatitis with so many millions of people affected, many people infected with hepatitis and unaware of their infection. So hepatitis A is an infection that does not result in chronic infection. So people become infected with hepatitis A, they often get sick, and then the body fights off the infection and they get better. Hep A is primarily transmitted fecal-orally or from contaminated poop or feces, from person to person, or often through contaminated food or water. The great news about hepatitis A is that it is vaccine preventable. It's one of the most effective vaccines out there. It is 2 doses of vaccine, and now, these days, currently, many of our children are being vaccinated for hepatitis A. They're recommended to get that at age 1, along with international travelers who may be exposed when they're traveling to countries that have high rates of hepatitis A, and others who are at risk for hepatitis A infection. So hepatitis B is a contagious liver disease that results from infection with the hepatitis B virus. I apologize, at this time the slides appear to be loading, but that should happen pretty soon, and I'm going to keep on going here. Hepatitis B is spread when blood, semen, or other body fluids from a person who is infected enter the body of someone who is not infected, often happening through sexual contact or through exposure to blood via syringes, often when people are injecting drugs. Hepatitis B, importantly, can also be passed from an infected mother to her infant at the time of birth. The good news is that we can prevent transmission of hepatitis B. A few interesting facts about hepatitis B. It can be a very serious infection. It's 50 to 100 times more infectious than HIV, and most people don't have any symptoms. Symptoms often develop over a really long period of time, up to even 30 years. Hepatitis B is kind of a funny virus. When an infant is infected, almost all, 9 out of 10 infants who are infected become chronically infected. But adults who have more mature immune systems are often able to fight off that infection. So when adults are newly infected with hepatitis B, only 10% of them become chronically infected. 15 to 25% of people who become chronically infected with hepatitis B develop serious liver problems like liver cancer, cirrhosis, liver failure. And many people do die of their hepatitis B infection. In 2010, approximately 2,000 people in the United States died from hepatitis B-related liver disease. So we have a lot of people who are recommended to be tested for hepatitis B, and unfortunately, many people who should be tested are not being tested. CDC recommends that anyone born in Asia, Africa, and other regions that have moderate or high rates of hepatitis B be tested for the infection, and I think CDC's website has a really wonderful map. If you are concerned about that, please do follow up. Unvaccinated people whose parents are from places where there's a lot of hepatitis B should also be tested. Hepatitis B is sexually transmitted, so anyone having sex with a person who has hepatitis B, and men who have sex with men, as well as folks who have who even present at an STD clinic or have other sexually transmitted infections should be tested for hepatitis B. Hepatitis B has been known to be transmitted within households, so it's a good idea if you're living with someone who has hepatitis B to be tested. Hepatitis B is, as I said earlier, very easy through drug use, so anyone who's injected drugs should be tested. Pregnant women, because we know we can prevent new hepatitis B infections transmitted from a mother to her infant at the time of birth, we try to test all pregnant women to ensure that they don't transmit that infection to their infant. People with HIV infection are also at higher risk, as well as people on dialysis. And people who receive chemotherapy and other types of immunosuppressive therapies should be tested for hepatitis B before they start those treatments, because if they had hepatitis B and it was undiagnosed, it could result in an acute flare-up, and people have died because they didn't realize that they had had hepatitis B in the past and they started on some of those therapies. Hepatitis B is diagnosed with a specific blood test. It's a fairly simple blood test, but it is not a blood test that is usually done when your doctor says he's going to check you for, quote, everything, unquote. For acute hepatitis B cases, doctors usually recommend rest, adequate nutrition, and monitoring, but there is no treatment specifically for acute or a new hepatitis B infection. But for chronic hepatitis B, individuals should be monitored regularly by a doctor, as with any chronic health problem, and also be evaluated for liver problems. There are treatments available for hepatitis B as well. So the great news about hepatitis B, similar to hepatitis A, is that we have a safe and effective vaccine. The entire series is needed, all 3 shots over 6 months for long-term protection, and booster doses are not currently recommended, so the good news on that front is if you've gotten all 3 doses of your hepatitis B vaccine, then you don't need to get any further shots. I am going to transition into hepatitis C. Hepatitis C is a contagious liver disease. It can result in infection with the hepatitis C virus. We know that about 15 to 25% of people actually clear the virus without treatment for hepatitis C. However, 75 to 85% of people who get infected with hepatitis C go on to develop a chronic or lifelong infection. And over time, as we saw with chronic hepatitis B, liver damage, cirrhosis, liver failure, and liver cancer can result. Hepatitis C can be a very serious liver disease. In the United States, an estimated 3.2 million people have chronic hepatitis C, and each year the CDC estimates that about 17,000 new Americans become newly infected. Chronic hepatitis C can result in long-term health problems, and again, CDC estimates that about 15,000 people die every year from hepatitis C-related. The graphic at the right-hand side kind of illustrates the difference in magnitude comparing the number of people who are infected with HIV at about 1.1 million these days with the number of people who are chronically infected with hepatitis C. Although we hear a lot more about HIV, in large part because people in the early days of the HIV epidemic died very suddenly or very quickly, and a lot of energy and resources have been put into raising awareness about HIV. The fact that many more people have chronic hepatitis C infection is really a public health issue, and we are working now to raise awareness about chronic hepatitis C and get people tested. Because of the shared ways that hepatitis C is transmitted through blood exposure, occasionally through sexual exposure, there are people who are co-infected with HIV and hepatitis C, overlapping circles in the diagram. C spread usually from an infected person to someone who is not infected. Most people today are exposed to or other equipment to inject drugs. However, before 1992, we didn't have a test that could accurately identify the hepatitis C infection. And so before 1992, many people were exposed through the blood supply, through blood transfusions, organ transplants, or outbreaks from contaminated medical settings. We should get tested for hepatitis C. Current or former injection drug users, even if they only injected one time or many years ago, anyone who was treated for a blood clotting problem before 1987, which is when we started being able to ensure that blood clotting factors were safe. Anyone who got a blood transfusion or organ transplant before 1992, and anyone who has ever been on long-term hemodialysis. People who have abnormal liver tests should be tested for hepatitis C as well. Anyone who has liver disease, to see if it may be the hepatitis C that's causing the abnormal liver tests or the liver disease. And just recently I spent some time with liver doctors who often hear, oh, well, my liver enzymes were only a little bit elevated, or they were just slightly abnormal. But the liver doctors believe that there is no only a little bit abnormal and recommend that anyone who has any abnormal liver enzyme be tested for hepatitis C. So healthcare workers or public safety workers who are exposed to blood through needle sticks or other sharp object injuries. Again, folks who are infected with HIV because of the shared modes of transmission should be tested for hepatitis C. And then just recently, last year in the summer, the CDC came out with new recommendations recommending that individuals born between 1945 through 1965 be tested for hepatitis C. This is because a good proportion of people, about 75% of people chronically infected with hepatitis C, were identified to be in that age group of individuals born between 1945 and 1965. Most of them don't have any symptoms of infection, and many of them don't have any rationale or reason to believe that they were exposed to hepatitis C. And so in order to reduce the number of people who are walking around with undiagnosed hepatitis C, the CDC, as you saw in the video just recently, recommends now that folks born between 1945 and 1965 have a one-time test for hepatitis C. Hepatitis C is diagnosed using a blood test. It is a two-step process to diagnose people with hepatitis C. Test that looks for antibodies. Antibodies are proteins produced by your body when it's exposed to an infection. And if that screening test is positive, then a different blood test is needed that actually measures hepatitis C virus in the blood. So it is a two-step process. However, it is recommended that folks get the first test and to see if they were ever exposed, and then test for the actual virus itself to see if they're still infected. As you may remember in a previous slide, I mentioned that 15% or so of people who are infected with hepatitis C actually are able to clear the infection. And so there is a chance, even if the antibody test is positive, that a person could have resolved that infection and no longer be chronically infected. So the other good news about hepatitis C is that we have treatments that can cure it. So we've had hepatitis C treatments that resulted in a cure for a fairly small number of people who took them for over a decade. However, those treatments are rapidly changing. They've already begun to change, but we're very excited about the new treatments that are coming down the line. So for the past little over a decade, we've had pegylated interferon, which are effective in a little less than half of people, and actually resulting in a cure for hepatitis C. Unfortunately, those two medications taken together have some very serious side effects, and many people weren't able to even tolerate or take those medications at all. So there are some new direct-acting antiviral drugs that have improved cure rates up to 75%, and some people are even able to take those for a shorter time period than the previous treatments. Our pharmaceutical industry partners have been working along with researchers from the National Institutes of Health to develop new drugs that are even more effective that can help cure many more people. Two of these new medications are expected to be on the market starting just next month. And there are, more than 20 new drugs in the pipeline that will be start becoming available starting in 2014 and 2015, and I'm sure well beyond that. So we are looking at being able to cure more than 90% of people in the coming years of their chronic hepatitis C infection. And again, this is so important then to identify individuals before they develop serious liver disease or liver cancer, because we can save lives. I'm going to turn it back over.
Thank you, Corinna. In 2010, the Institute of Medicine published a report, Hepatitis and Liver Cancer, a national strategy for prevention and control of hepatitis B and C. This report led the Department of Health and Human Services under the direction the Secretary for Health, Dr. Howard Koh, to develop a national viral hepatitis action plan. The action plan was a 3-year plan for 2011 through 2013. That plan had 6 goals to accomplish, and they're on the screen in front of you: educating providers and communities to reduce health disparities, strengthening surveillance to detect viral hepatitis transmission and disease, eliminating transmission of vaccine-preventable viral hepatitis, reducing viral hepatitis cases caused by drug use behavior, protecting patients and workers from healthcare-associated viral hepatitis, and improving testing, care, and treatment to prevent liver disease and cancer. It was further decided that since this plan would be ending this year, and there was still some work to be completed from the original plan, and agencies and departments across the country, and across the government involved in viral hepatitis response, decided that it was important that we continue our work, and so now we are entering into a new plan which will be released in the late winter of next year. Renewing the action plan, hopefully May 2013, Assistant Secretary for Health Howard Koh announced the renewal of this viral hepatitis plan, then to run 2014 through 2016. The renewal gives us all a chance to join together to eliminate perinatal hepatitis B, increase awareness about who should be tested, identify new collaborative partners and programs, and identify opportunities with the Affordable Care Act. Also, this new plan will be constructed such that it will be far more user-friendly to the general public and to you, our listening audience today, to help you become stronger partners with us in addressing this national health issue. One thing that we get as a question from a lot of our colleagues across the country is what resources are available to help us in promoting public awareness and education about viral hepatitis. I am glad to say that the CDC has been very engaged in its Division of Viral Hepatitis to develop tools and instruments to help us educate the public and to keep the public aware of the importance of viral hepatitis screening as well as viral hepatitis testing, and hopefully those who are infected with hepatitis B or C are connected to vital care and treatment services. On the screen now you see what we believe is one of our most important tools that the CDC developed. It is their hepatitis risk assessment. You can go online and access this risk assessment tool, and it can give you a very generalized understanding of whether or not you are at risk for hepatitis. We recommend to you that you take the information derived from taking this test and discuss it with your doctor, and hopefully you and your physician can decide that a hepatitis test for you, and that at this time you'll learn about your status. Other tools on the CDC are badges and posters and brochures, and also we have pins for people to wear to have them serve as ambassadors of education for viral hepatitis. And you become an immediate partner of the department in doing so. Furthermore, there are fact sheets, very important fact sheets on the website that are targeted to racial and ethnic groups, women, to expected mothers, and also looking at issues of subpopulations like men who have sex with men, substance abusers, and so forth. There is a broad dearth of information online available to the general public. In addition, there are resources online to acquaint physicians and clinical people about the importance of this, a response to viral hepatitis, as well as tools to further educate them about treatment and care of patients who come to them for services. At this time, and it's my pleasure to introduce our guest speaker this afternoon. Our guest speaker is Andy Thomas. She is president of Health Pro. She is the founding partner of a group called the Support Partnership. And if you turn to this slide on your screen, you will see that there is a hepatitis hotline, which Andy will talk a little bit about in her presentation. It gives me great pleasure at this time to introduce you to Andy Thomas.
Thank you so much, Christopher, and I am delighted to be here, and thank you to the Office of Women's Health, the Office of HIV/AIDS, Corinna Dan, Dr. Coe, Dr. Valdesari, and all of the other dignitaries. It is unusual for me to speak from a personal level, so in my comfort zone, I'm going to start by telling you how I got to where I am, and then I'm going to share some deeply personal information with you. When I first found out about hepatitis C, I had, this was 17 years ago, I had an unusual blood test, and I had a need to have a colonoscopy. So I was referred to a gastroenterologist, and he noted the abnormal liver enzymes, and it totally scared me, freaked me out, telling me everything about hepatitis C and the drugs that were worse than the cure and so on and so forth. And we never followed up with that conversation with a blood test that particular visit. When I went to follow up with him a year later, I reminded him about the blood test, and we did it. Now, 3 or 4 weeks later, after voicemail tag, I finally received a call back from him about my test results, both the colonoscopy, the follow-up colonoscopy, as well as the blood test. and I was standing in the lunchroom at a large employer where there's probably 50, 55 people at lunch, and I'm in the corner with the phone trying to be discreet, and I got a good news, bad news phone call. The good news was that my colon was fine. The bad news was that I tested positive for hepatitis C. And I huddled in the corner with my hand cupped over the mouthpiece and asked him, what does this mean? Am I infectious? What about my husband? What about my children? And his response was, just don't bleed on your kids. That was 17 years ago. I would love to say that globally throughout the U.S. that gastroenterologists have gotten a better message, but that's not necessarily the case. But it's getting better. But my personal experience, that one moment, and when I went home and pulled this up on the internet, and way back when, 17 years ago, there were very few websites about hepatitis C. I thought I was going to die. Absolutely was convinced, to the point of, starting to call family members and tell them goodbye. And then as I educated myself further, it became very clear that wasn't the case, that there was a huge variability in disease progression, and there was no absolute death sentence associated with this. And that really pissed me off. So I went on treatment because I wanted to not be infected, and while I was on treatment, I'm having this completely upper middle class suburban thing where I'm laying in the pool, the husband's grilling steaks on the grill, and it occurred to me that I needed to do something about this, that I could actually quit my day job and do this full time. Somebody had to. So I did. Husband said okay, by the way. So I did. I started Hep C Alert, which was founded in 1997. And originally, our major program was a national counseling and referral helpline, 877-HELP-for-HEP. This model wasn't a traditional passive helpline where we'd receive a call and do some counseling, maybe mail out materials, but instead was a helpline where we made an initial connection and then followed up with those individuals over the course of time as they moved through the stages of care access and treatment and health decision-making. I'm really happy to say that despite the changes in the nonprofit situation that I'm working in, that helpline still exists. But this all started with a pissed off woman. And I always say, it's like, how do you start a nonprofit? You make a woman angry. My needs ultimately got met because I've worked in the medical field and in an administrative capacity, and it was really easy for me to make my way through this information. But for those individuals who weren't as fortunate as I to be able to synthesize all of the information out there and search it out and make sense of it and apply it to decisions, that's what really was the driving force. Hep C Alert ultimately our office moved into a medically underserved low-income minority community in North Miami, and it became clear that hepatitis C was not a primary concern for this community. And it was at that point that the organization began expanding its roster of services to include all viral hepatitis screening, vaccination, HIV testing, and as well as chlamydia, gonorrhea, and syphilis testing. And then ultimately, we added cholesterol, blood pressure, and obesity screening. So we became a preventive health home with a population of primarily, like I said, medically underserved minority young adults. It was wildly popular, and we had, and the concept was so well accepted. We didn't advertise, but in the course of 4 years, as we had expanded our roster of service and integrated them into a single visit, we increased our volume by 900%. We used to see 60 people a month, and I had panicked because I thought, oh my gosh, we'll never keep the doors open if we only have 60 people a month come in, to over 600 people a month. It was an amazing transition, and this integrated service model over the course of 8 years was tweaked and adjusted and responsive to the feedback that we got from the community that made it incredibly successful. Unfortunately, with the funding issues, let's just say that, Hep C Alert, which was renamed Alert Health because to better represent the integrative service model, had to close in July of 2011. And I formed Health Pro, not as a direct-to-consumer service organization, but rather to assist other organizations expand their services and look at the service integration model and spread the word. So it's giving away the program. What I'm happiest about is that Help for Hep, 877 Help for Hep, continues on. So the very first program that was started with Hep C Alert, not Pepsi, Hep C Alert 17 years ago, lives on. But it lives on not run by a single organization, but rather as a partnership. One of the passions that I have is care linkage, but I think the peak of this is ensuring that people are tested. And as Corinna was going through the risk factors for testing, for the criteria for hepatitis C testing, when I first read the risk factor list from CDC, personally, I didn't fit into any of those risk factors. I was not an injecting drug user. I didn't have a blood transfusion. I didn't have a needle stick from an infected source, so no kidney dialysis, so on and so forth. I did over the years have intermittently, mildly abnormal liver enzymes, which my primary care physician had attributed to alcohol consumption, social drinking, and it was ignored. And it was just amazing to me the day that I got the phone call in the lunchroom that I could have been infected for what I estimate to be 18 years, done everything that I was supposed to be doing. You get a job, you get married, you have children, so on and so forth. I'm beep-bopping through life feeling healthy and well to find out that I'm infected with a virus and I don't meet any of the criteria for ever having been screened, even with the abnormal liver enzymes. I am happy about the CDC's recommendation, as well as the adoption of this recommendation by the United States Preventive Services Task Force to make it a B recommendation, which means it is recommended, hepatitis C screening is recommended for a baby boomer population. And I want to say, a one-time test, one test, one time. As a call to action, is the only thing you take away from this call is to speak with the people with in the highest prevalence population, baby boomers, people that look like me, maybe don't look like me, but they're in my age group. One test, one time. Then you can put it to bed. If the test is positive, there are better resources and more information today than there ever has been in the past. And with the Viral Hepatitis Action Plan and the interagency cooperation within Health and Human Services, as well as other governmental agencies, and the miraculous change in the treatment paradigm from something that treatment that was incredibly difficult to tolerate and to an all oral regimen or an interferon-based regimen with oral medications that make it more powerful. This is such an exciting and empowering time in hepatitis C advocacy. So I want to share a couple things with you about finding out I was infected, because I'm going to speak as a woman, hopefully to all of the women that are on the call, and men, please bear with me. When I was diagnosed, I felt dirty. I felt contaminated, infected. It was an oh my God moment. How could this happen to me? One of the things that was one of the things that was hardest to cope with was menstruation. So I make a joke of this, but it wasn't funny, and it really still isn't. But being diagnosed with a viral infection that's transmitted through blood, when you menstruate, it's like my crotch was a biohazardous waste dump, and all of the sanitary products associated with it had to be treated accordingly. It was as if this one part of my body was no longer okay for general consumption, if you get my drift. It took me many, many months to adjust, and I know this happens with women with hepatitis B as well as those who have been diagnosed with HIV. It's a very personal thing for women, and it's not spoken of very often. But in counseling and supporting women, it's something to bring up and as part of the adjustment and towards coping. It's important for counseling women with a bloodborne communicable infection in the management and disposal of their sanitary products. I needed to put that out there. I'm pretty sure nobody else will ever say this to you. But I think the other takeaway was about having infected my children. And thank God, both of my children and my husband tested negative. But as a mother, not knowing that I was infected, when I became pregnant and had my children, finding out years later, when they were old enough to realize that something was up, that was a real challenge for me to adjust to as well. And again, I'm sharing this because it's an important part of the counseling, coping, and acceptance, and as well as the recommendation for the children of women who have hepatitis B and hepatitis C to be screened as well. So I'd like to close by reading you a poem that I've read out loud now 3 times. I wrote the poem after I went through treatment, and I did go through treatment, the old-fashioned treatment with the injection and the pills. That was very difficult, and I don't know if you know how difficult it is or if you've known anybody who's gone through it, but it's tough. It's doable, but very difficult to get through. But every time I've read this poem, I've cried. But it was a poem that was in me, and I'd like to share it with you as I close. The poem is titled, Get It Out. When I first heard the news, I was shocked and dismayed. Me have hepatitis C? I thought I'd been played, because when my doc told me just don't bleed on your kids, I lost all control and my life hit the skids. That one single moment, it changed my whole view. My thoughts filled with pain, my life never the same, and this refrain kept repeating as my soul shouted out, there's a virus inside me, get it out, get it out. I drew my kids close to tell them my fate, and I said my goodbyes, and please live without hate, because even though I'd be dead in a matter of years, and they might be infected, my greatest of fears. And after damaging them for life with his dramatic goodbye, I called my husband on the phone and I started to cry. I told him, divorce me. I'm infectious and sickly, and John, I insist, get away from me quickly. At one single moment, it changed their whole view. Their thoughts full of terror, hoping there was some error, the refrain kept repeating as their souls shouted out, there's a virus inside her. Oh, my God, get it out. Druggies and whores, that's who gets this infection, not middle-class moms who live in perfection. But I confessed and explained that I wasn't really a junkie or whatever, but their stares became chilly, like I was a leper to avoid at all costs. And when my friends shunned me, that's when I got lost. That one single moment, they changed their whole view, their eyes filled with accusation and a bunch of fascination. The refrain kept repeating, my thoughts clouded now. I'm really not contagious, but I'll manage somehow. Poison medicine injected until out my hair fell, needles and pills daily and living in hell. Dropping 30 pounds on a drug-induced diet is when curious folks started acting real quiet, spreading rumors that I had AIDS or that I was going crazy. And I let them believe it because that kept them busy. That one single moment, they changed their whole view. Rumors rife with suspicion and not even 1 ounce of contrition. The refrain kept repeating as my mouth snapped shut. It's a virus, for Christ's sakes. Why don't you shut the hell up? My family embraced me with true love and protection. I didn't have to ask. They just gave me connection. Loved me unconditionally through angry depression, through poison, through treatment. They never questioned my choices or my secrets or my past or my tears. Instead, gave me love and shared in my fears. That one single moment, I changed my whole view. I felt my whole family rally around me. The refrain kept repeating as my heart shouted out, there's a virus inside us, and we're getting it out. I failed the first round, or the drugs, they failed me. But a second chance came round to become virus-free. So I asked my kids who were leaving the nest in a hurry if they'd prefer that I wait so they wouldn't have worry. And they both said, no, Mom, we want to be near. In case you need help, we'll all be right here. So even though I did I'm going to die drama, they showed me how much they love me. They're not perfect, Mama. That one single moment, we changed our whole view. Our hearts became joyful because the drugs were so powerful. The refrain kept repeating, one voice united in shout. There's no more virus inside us. We got it out. We got it out. Thank you.
Wow, Andy, I cannot thank you enough for sharing with us your very heartfelt story, your personal experience, and also giving us the history of the organization you founded and telling us about the work you continue to do. We appreciate you very much, and I'm sure that the hundreds of people who are online with us now join me in thanking you very much for your participation in our webinar.
Now I'm going to go and have a good cry.
But you can't go too soon because we're going to move into our Q&A section, and I'm sure there may be some questions in this portion of our program this afternoon that you may get a question or two from our listening participants. So at this time, I'm going to ask the operator to join us again to explain how one can ask a question of myself, Christopher Bates, or my colleagues, Dr. Lydia Martinez, or Karina Dan. So, operator?
Thank you. We will now begin a question and answer session. To ask a question, please press *1. Please unmute your phone and record your name when prompted. If your question has been answered, you may withdraw your question by pressing *, then 2. Once again, for a question, press *, then 1. One moment, please. We're getting questions in. Our first question comes from Michael Richardson. Your line is open.
Yes, this is Michael Richardson. I was wondering, Andy Thomas, when you was talking about your menses, what education did you give the women on how to get rid of the waste?
Great question. Well, I had younger kids, and I wanted to make sure that they weren't going through my trash. What I did is in my bathroom, obviously wrapped the products in towels, and then I sealed them into a plastic bag, and they went into the regular trash can. But I did educate the children, both for my menstrual, to don't go into this, but also not to share my toothbrushes. My daughter had just started shaving her legs, and not to share my razors. And in our kitchen, where Mom cuts herself regularly, we actually put this is a great trick, whether it's HIV, hepatitis B, or hepatitis C, kind of do-it-yourself blood cleanup kit. We had gauze, we had like a first aid kit with a lot of gauze and a weight and cellophane that you could wrap around the gauze to contain whatever was bleeding. And then in there we had maxi pads to soak up any blood that had gotten on hard surface or on any surfaces. So, but it was important that I wrap everything up, that it wasn't just, the sanitary products weren't just kind of just wrapped in toilet paper and put into my little trash can.
Our next question in queue comes from Hilaire Kerman. Your line is open.
Thank you. I would like to know if someone can elaborate on the current treatments for Hep C.
Sure. This is Karina Dan. The current treatment for hepatitis C actually depends on a number of factors. There are 6 known genotypes or different strains of hepatitis C. And so depending on the genotype, then the specialist or the doctor that's taking care of the patient would recommend different treatments. However, in the United States, about 75% of people have genotype 1. And the current standard of care for genotype 1 is pegylated interferon, which is an injection given once per week, along with ribavirin, which are pills given usually twice a day by mouth. And they usually add a third direct-acting agent. Currently, there are 2 available, boceprevir and telaprevir, and those are given along with the interferon and ribavirin. So that treatment lasts for between 6 months and 1 year, and the length of treatment depends, again, on some patient factors and on how the person responds to the early part of treatment. So it's a fairly complex treatment, and that is, as I said earlier, going to be evolving and hopefully becoming much simpler over time. But currently, most people will get the shots once a week and the pills by mouth daily.
how long have these treatments been available?
So the pegylated interferon has been available since 2001. Prior to that time, there was a short-acting interferon that people had to take 3 times a week, also injected. And so the peg interferon and ribavirin has been around since 2001, but the other 2 drugs were only approved in 2011. I did just attend the big liver meeting, which just ended earlier this week, and all signs are that the newer medications that are more effective, they're still, for patients with genotype 1, they're still paired with pegylated interferon and ribavirin, but they'll result in a cure for, 75 to and upwards % of people who take them, and those we hope will be, or anticipate that they'll be approved at the end of November and December. So there are 2 new drugs that are expected to be out later this year.
Okay, I would like to know if you're going to go up on the net with this information so I can print it out.
I think the easiest way to handle follow-ups would probably be to please contact Christopher Bates, whose contact information, it was on the registration, and we'll put up the slide now that has our contact information. But if you could follow up with us, then we can share additional information. Thanks.
Superb. Thanks so very much.
And our next question comes from Ruth Lassiter. Your line is open.
Hello?
Ruth, did you have a question?
Unmute your phone, please.
Can you hear me now?
Yes.
Okay, my name is Judy Hardy, and I'm a CD nurse in Wake County, Raleigh, North Carolina. How's everybody?
Great, thank you.
Good.
Good. My question is for Andy, and I really appreciate her personal story and being so honest and real with what she had to say to us today. And if I missed this, I apologize. But, Andy, I didn't hear you, I don't recall hearing you say if any sources, or did you ever identify potential risk or sources where you contracted the Hep C? Being a CD nurse, we want to do investigation and find out the answers. So that's why I asked that question. Thank you.
Thanks. And the question, I was expecting the question. So the list that Corinna had gone down, obviously, I said I didn't fall into those risk factors, but I was a medical assistant for many, many years, and little nicks and cuts, and we used to do in-office surgery, so I'd scrub the tools without gloves and this really terribly nasty toothbrush and then put them in cold soak. And so there was potential occupational exposure, but the second risk factor for me is that I grew up in South Florida in the 70s, and I put things in my nose. Neither of which, that was like as discreet as I could be. I experimented with intranasal drugs, and those are the risk factors that I have, which fall really kind of firmly outside of the risk factors that had been published for so many years, which is why the recommendation from CDC and the the United States Preventive Services Task Force is so exciting that it moves away from, for this population, the people born between 1945 and 1965, it moves away from risk-based assessment to population-based. It's age-based, because there are so many ways that I could have contracted this. Those are the 2 that fall into risk factors, that are potential risk factors. But who knows? All of this was, all of us, that's it. Who knows? We just know that the highest prevalence of chronic hepatitis C, the 75% of people with chronic hepatitis C fall within this birth cohort, this age range, and being able to move away from the risk-based assessment for this population really helps move people into screening.
Thank you, caller.
And our next question comes from Karen Wooten. Your line is open.
Yes, good afternoon.
Good afternoon.
Question for the panel. Certainly with getting the word out for 1945 to 1965 for testing one time, the question of cost may come into the picture here in regards to coverage by health plans or now under the Affordable Care Act, Medicare and Medicaid. What types of responses might one have to provide some feedback when fielded with those questions for testing?
Sure, that's a great question. A couple of answers. One piece of good news we learned earlier this year, actually in response to the change in the U.S. Preventive Services Task Force recommendation, and also to some efforts by advocates in the community, the Centers for Medicare have begun the process of determining whether hepatitis C will be covered nationally for individuals born between 1945 and 1965. So they've opened a national testing determination analysis, and they'll come up within the next year or so, we're told, that Medicare will make a decision about sort of a blanket payment for tests for hepatitis C. So that's one piece of what you asked for. The other component that we understand is that the Affordable Care Act does have preventive services included, and those preventive services include any U.S. Preventive Services Task Force recommendation that is an A or a B grade. And so it is part of the law then that payers will have to cover the test for anyone that has a risk factor as well as anyone born between 1945 and 1965 for hepatitis C.
Okay, that's good news. Another question, I deal with a number of insulin-dependent diabetic patients.
Yes.
So therefore, exposure to needle sticks, whether it's children, adults, family members being around, injectable supplies.
Sure.
So that would be a good targeted audience for this type of discussion, getting the testing.
Absolutely. The CDC just, I believe it was the end of 2011, came up with an expanded recommendation for hepatitis B vaccination for anyone who is diabetic. They should be tested first and then vaccinated for hepatitis B because CDC identified a number of outbreaks related to people who had shared the glucose testing equipment, from the monitors to the lancets, the whole range of supplies. So, in order, we have a safe and effective vaccine for hepatitis B. We should be using it in all insulin-dependent diabetics. But for hepatitis C, certainly, it's a good idea, especially if there has been cross-contamination or, potential exposure of the patient. They should be tested. But additionally, you're absolutely right that education of insulin-dependent diabetics about the need to, store their, dispose of their sharps safely and not share their equipment. And even because hepatitis B and C are potentially hardier than some other infections, they could even live on surfaces. So making sure that tabletops and, other surfaces are clean is another important message to get out there.
Great. And one final question in regards to public health policy, particularly in hospitals, environment, and as the accountable care organizations expand because of ACA, the policy of one-time testing or perhaps annual testing for those healthcare providers who are continually being exposed and at risk.
Yes, you make a good point. I know that the CDC has a very long list of policies and analyses to inform the policies that they need to do, but among them, certainly near the top of the list is to review and revise policies around hepatitis C for healthcare professionals. Last summer, they released new recommendations for the management of hepatitis B infected healthcare professionals and students, so folks in the health professions who are chronically infected with hepatitis B. However, it is on our radar that we do need those updated guidelines for individual healthcare professionals who are infected with hepatitis C as well. So I'll share your feedback with my colleagues, and I appreciate your recommendations.
Thank you.
Our next question comes from Michael Richardson. Your line is open. Please check to see if you're unmuted. We're not able to hear you.
Yes, this is Michael. On hepatitis B, how long will that live on the surface? Also hepatitis C, and what cleaning solutions do y'all recommend?
So hepatitis B is extremely hardy and can live for up to 7 days, even in dried blood. Hepatitis C is not that hardy. It can live, estimates are about 3 days outside the body. That would depend on the environment. If it were, for example, in a syringe or a water bottle, it may live longer than out in, exposed to air. I'm not an expert on biohazardous waste cleanup, so I don't know that I, certainly using gloves and, using some kind of cleaning product that kills viruses. Many of them are available on the market, but I don't think, my office doesn't have any specific recommendations for that, and I would imagine that the CDC and or OSHA would be very good resources if you need additional information.
Do you recommend bleach, using bleach to clean with?
Bleach, I have to say I'm not as expert on the disinfection as I probably should have been. I'm sorry, I'm not prepared to give a absolute yes or no. I think bleach has been used in the past, but I haven't seen the data on how effective it is. I'm sorry.
And then one more question while I'm on the line. In New Mexico, we don't test pregnant women for Hep C. Do you see that coming nationwide?
Well, that is a really good question. So the reason that we test pregnant women for hepatitis B is because we can interrupt transmission. We have the vaccine for hepatitis B. We also have immune globulin for hepatitis B. And for infants born to women who have chronic hepatitis B, if you give those two things together, you're more than 90% likely to prevent the hepatitis B being transmitted. However, we don't have a vaccine for hepatitis C, and we don't use immune globulin in that way for hepatitis C either. And we don't really have any way to stop transmission. But this is a very quickly evolving field, and I mentioned earlier that I was at the liver meeting, And there is some research being done on the transmission of hepatitis C from infected mothers to their infants. So I believe that we'll start hearing more about that over the coming years. At this time, I think if a woman has a risk factor, it's a very good idea. It's a wonderful time to intervene when she's pregnant to get her tested and diagnosed. But it's not yet considered standard of care to test women for hepatitis C just because of pregnancy.
One other question. Do we still test at 18 months if it's a pregnant woman that delivers a baby?
The infant should be tested at 18 months after the infant has completed that series of 3 hepatitis B vaccines. So yes, the recommendation is that the infant receive the hepatitis B vaccine and the immune globulin at birth, and then that infant should also receive the 2nd shot on schedule and the 3rd shot of the hepatitis B vaccine, on schedule. And then they test the infants at 18 months to ensure that that vaccine worked, and then we have, that's considered a success story when the infant didn't get infected and has become immune to hepatitis B. So yes, that's currently the standard of care.
Once again, if you do have a question, please press star then 1. Now the next one, the name recorded was faint. I believe it was Singh. Your line is open.
Hi, this is Clara Sang from Arizona. My question was about the development of a hepatitis C vaccine. Is there any news or research going on with that?
Yes. There are clinical trials ongoing currently testing a potential hepatitis C vaccine. We're fairly early in the process of the clinical trials, so I believe that it's only being tested in 1 or 2 small studies, but we're very hopeful because we really recognize the need for a hepatitis C vaccine. And so, we have one for A and B. We've seen amazing reductions in new infections for hepatitis A and B, and so we're very, very hopeful that that there will be a hepatitis C vaccine. However, I can tell you that it is a number of years away. I would say likely at more than 5 years, at least down the line.
Corinna, I'd like to add to that. The distinction between the A and B virus and the C virus is hepatitis C is an RNA virus, and as is HIV. DNA viruses, when they make copies of themselves, make good copies, so it's easy to develop a vaccine. RNA viruses, it's like a 7th generation fax copy. You know how that gets skewed and whatever else. It's much more of a moving target. So the hepatitis C vaccine development will follow more along the lines of HIV vaccine development, from what I understand. Is that, Corinna, is that correct?
Absolutely. The hepatitis C virus itself is very diverse. It makes a lot of mutant copies of itself, and so that has been one of the big challenges in developing a vaccine, is that there are so many genotypes of the infection, and it's been really challenging for researchers to even develop a vaccine to start with.
So that's where prevention comes into place.
Absolutely.
Yes.
Our next question in queue comes from Aretha Jones. Your line is open.
Yes, good afternoon.
Good afternoon.
My question is, I'm going to say that I have AIDS. I was diagnosed in 2009 after contracting a viral infection. with that said, I became homeless, and I've been segregated to a congregated environment in housing. And my question is, what is my, or I should say, for my own protection, with people, my exposure of the hepatitis B or C, because I know I'm around a lot of people who cough, who do have liver diseases, who are still using drugs and alcohol, which I don't, I'm concerned about, I took the 3 injections, but that was when I was in my teens. So now, what do I do as far as keeping myself safe from such exposure?
Sure. Well, the most important way that you can protect yourself is to not expose yourself to other people's blood. You already mentioned that you aren't injecting drugs, so that's a very, very important, way to prevent exposure. But any blood exposure, and that can be if there's fighting and folks are bleeding, tattoos could potentially lead to exposure to hepatitis C and B infection. But hepatitis C and B are not spread through coughing or vomit or urine or feces. So it's really, I think, focusing on not exposing yourself to other people's blood. And then hepatitis B certainly, and hepatitis C to a lesser extent may be sexually transmitted. So you would want to make sure that, you protected yourself during any kind of sexual encounter as well.
In short, this is Andy. I always say, don't share stuff.
Mm-hmm.
Toothbrushes, razors, so on and so forth. And tattoo inks, tattoo needles, don't share stuff.
Right. We in the HIV prevention arena, I think early on they identified that, toothbrushes and razors weren't really ways that HIV could be spread, but because Hep C and Hep B are hardier viruses, we want to make sure that folks aren't sharing those either, because, if someone's gums are bleeding and another person comes along behind them and uses the toothbrush, then there could be blood exposure there.
Okay. And is that also as well as saliva, like say if someone is spitting, and it's a lot of that also that goes on. I see people spat a lot.
Well, so again, I think often likely folks they're not taking very good care of their oral hygiene. And so if they have bleeding gums or a sore in their mouth, there is a slight chance that there's blood in their saliva. So it's all comes back to blood. I would avoid saliva or, if somebody spits something out, I would avoid that myself because of the potential for blood exposure there. But generally, hepatitis C is not spread through saliva.
Okay. All right. Thank you very much.
Thank you for your call.
You're welcome.
Operator, it seems like we've gotten to the top of our hour here. This has been an exciting event for us here at the U.S. Department of Health and Human Services. I did get one question, possibly two, via the Internet, and I just want to raise it with all of our listeners who are still online. And that is, as soon as we have a web address and can secure a copy of the audio recording of this event, we'll try to post it for people. So all of those who participated or registered for the call, we will send that information to you. We've also had some specific requests from people for copies of the slide presentation today, and that, too, we will make available to those who wish to have a copy. Our information is still online. Please jot it down. but you can also refer to the announcement that led you to this call today and this webinar, and that information there on the announcement definitely can be used to connect with me, and hopefully you can do that in the near future. The last thing that I'd like to say is thank you to Andy for stepping up and sharing her most personal story. We'd also like to thank Dr. Lee for joining us and opening up our our webinar this afternoon. And last but not least, we'd like to thank all of you for joining us, and we appreciate your participation. Your show of interest in this particular webinar encourages us to move forward and hopefully hold other webinars like this in the near future. So good afternoon and good day to you, unless we have a final statement from our operator.
And this does conclude today's conference. Thank you for your participation. You may disconnect your line at this time.
Thank you.
Thank you.